Tonight, a breakthrough that helps answer one of the toughest questions for men with prostate cancer.
Yeah, to treat or just watch. Most prostate tumors are not lethal. CBS 2's Dr. Max Gomez is here, and he says the answer may lie in a new genetic test. Dr. Max?
You know, that's right, Christine. When doctors aren't sure whether a prostate tumor is aggressive and lethal or it's indolent, meaning slow growing and relatively harmless, men often opt for surgery or radiation just in case. But that can cause impotence and incontinence. Now there's a way to tell the difference. Like millions of other men, Harry Immerman has been checking his PSA levels on a regular basis. Then about 15 years ago, it started to climb.
I've had my prostate biopsied at least a half a dozen times.
For nearly 250,000 men a year, that biopsy comes back as cancer, sometimes low grade, sometimes much worse. But that determination is made by the way the cancer cells look under the microscope, and that's not always a reliable way to judge a cancer's aggressiveness.
Occasionally we say, your cancer looks like it doesn't need to be treated, but in fact, sometimes it's going to be worse than we think. Or your cancer looks like it does need to be treated, but see if it's really much more innocent.
Dr. Peter Scardino, internationally known prostate surgeon at Memorial Sloan Kettering Cancer Center, says that leads to overtreating some men who don't need it and undertreating those who had potentially lethal cancers.
We need ways to really quantitate that, looking more deeply into the DNA, the RNA, the fundamental structure that drives these cancers.
That's where this test from the same company that developed the BRCA gene test for breast cancer comes in. The Polaris test looks at the expression of 46 genes in a prostate cancer biopsy, the genes that a number of studies have proven to predict prostate cancer spread.
This test adds important, different, new information about the biology of the cancer that can help you make better decisions and better choices about whether you should be treated or you can be safely watched and followed with early stage prostate cancer.
The Polaris test is FDA approved, and it's done on the same biopsy tissue that a pathologist looks at under the scope. It's still not a yes or no answer, but in about 1/4 of prostate cancer cases studied, it spared the invasive procedures and side effects men fear. Christine?
Dr. Max, thank you. Great information.